For decades, seniors have been told one simple story about heart disease. Cholesterol is the enemy. Lower your cholesterol, avoid certain foods, take medication if needed, and your heart will be protected. So people did exactly that. They cut out eggs, watched every gram of fat, tracked their LDL numbers, and followed the rules faithfully. But there's a disturbing truth that rarely gets talked about. Nearly half of all heart attacks happen in people whose cholesterol levels are considered completely normal. At the same time, many people walk around with high cholesterol for decades and never develop heart disease at all. That contradiction should make anyone pause. If cholesterol alone were the real cause, those numbers wouldn't make sense. Something else is clearly driving heart attacks, something far more dangerous than cholesterol itself, and it has been hiding in plain sight for years. The real threat isn't cholesterol by itself, it's chronic inflammation inside the arteries. Inflammation is what turns cholesterol from a neutral substance into a dangerous one. Without inflammation, cholesterol tends to circulate without causing harm. But when blood vessels are inflamed, their inner lining becomes damaged and vulnerable. That damage allows cholesterol to penetrate the artery wall, where it begins a destructive chain reaction that leads to plaque buildup, clots, and heart attacks. This explains a pattern that confuses so many people. Someone can do everything right, have excellent cholesterol numbers, and still suffer a major cardiac event. It happens because cholesterol numbers alone don't tell the full story. If inflammation is silently damaging the arteries, cholesterol becomes fuel for the fire. Consider the case of a health-conscious man in his mid-60s who had his cholesterol checked every year. His total cholesterol was low, his LDL was well within the recommended range, and everyone assumed his heart was protected. Then one morning, without warning, he experienced crushing chest pain and collapsed. Emergency testing revealed a nearly blocked artery. The cholesterol numbers hadn't warned anyone because the real danger wasn't being measured. When inflammation was finally checked, it was severely elevated. His arteries had been inflamed for years, allowing plaque to build despite perfect cholesterol. This happens because cholesterol doesn't randomly stick to healthy arteries. It needs damaged tissue to latch onto. Inflammation creates that damage. When the artery lining becomes inflamed, it turns sticky and porous. Cholesterol particles slip inside, triggering an immune response. White blood cells rush in to clean up the cholesterol, but in an inflamed environment, the process goes wrong. These cells become overloaded, die, and form unstable plaque. Over time, that plaque can rupture, creating a clot that suddenly blocks blood flow. That is how heart attacks actually happen. This also explains the opposite situation. Some people have high cholesterol their entire lives and never develop heart disease. Their arteries remain calm and healthy. Without inflammation, cholesterol doesn't accumulate in vessel walls in a dangerous way. It simply circulates and gets recycled by the body. The cholesterol number looks scary on paper, but the arteries themselves are not under attack. One woman in her early 70s illustrates this perfectly. Her cholesterol numbers were consistently labeled high, and she was repeatedly warned that she was at serious risk. Instead of reacting based on cholesterol alone, deeper testing was done. Her inflammation markers were very low. Her artery imaging showed no calcification and no plaque buildup. Even years later, her heart remains healthy, despite cholesterol levels that would normally cause alarm. The difference was inflammation, or more accurately, the lack of it. This is the missing piece most seniors are never taught. Cholesterol is not the root cause of heart disease. Inflammation is. Cholesterol becomes dangerous only when inflammation is present. Focusing only on cholesterol is like blaming smoke while ignoring the fire. The real question isn't just what is my cholesterol, it's are my arteries inflamed? Without answering that, heart risk is being guessed, not truly assessed. Understanding this shift changes everything. It explains why some people are overtreated, others are falsely reassured, and why heart disease continues to strike without warning. In the next part of this discussion, we'll break down what actually causes inflammation in the arteries, how seniors can tell if it's happening silently, and the specific steps that calm inflammation and protect the heart at its root, not just on a lab report. This knowledge doesn't replace common sense or medical care, but it gives you the full picture. And when it comes to your heart, the full picture can be life-saving. Here's what decades of research actually show. And this is where most people are stunned. One of the longest-running cardiovascular studies in history found that after age 70, high cholesterol is no longer strongly associated with overall mortality. In other words, having higher cholesterol later in life does not reliably predict who lives longer or who dies sooner. What does predict heart attacks, strokes, and early death is inflammation. Markers of inflammation, especially C-reactive protein, consistently outperform cholesterol numbers when it comes to predicting real cardiovascular events. This pattern shows up again and again across large studies. People with normal cholesterol but elevated inflammation suffer heart attacks at alarming rates, while people with higher cholesterol and low inflammation often remain event-free. One landmark trial made this impossible to ignore. Thousands of participants with normal cholesterol but high inflammation were followed over time. Those who received treatment that reduced inflammation experienced dramatically fewer heart attacks and strokes, even though their cholesterol levels changed very little. The benefit came from calming inflammation, not just lowering cholesterol. This explains something that has confused patients for years. Some people take cholesterol-lowering medication and see their LDL drop significantly, yet they still suffer cardiac events. Others experience major heart protection even when their cholesterol barely moves. The difference is inflammation. When inflammation remains high, arteries continue to be damaged regardless of cholesterol numbers. When inflammation is reduced, arteries stabilize, plaques become less likely to rupture, and risk drops sharply. To understand where this inflammation comes from, consider a very common scenario. A man in his late 60s appears average on paper. His cholesterol numbers are unremarkable, nothing alarming, but he carries excess weight around his midsection, eats a diet heavy in refined carbohydrates and sugar, and spends most of his day sitting. What's happening inside his body is far more dangerous than his lab results suggest. That abdominal fat is metabolically active tissue. It constantly releases inflammatory chemicals into the bloodstream. Every blood sugar spike adds fuel to the fire. Physical inactivity removes one of the body's strongest natural anti-inflammatory defenses. Over time, his arteries become inflamed and fragile, even though cholesterol looks normal. When lifestyle changes address the root cause, the transformation can be dramatic. As excess weight comes off, blood sugar stabilizes, movement increases, and nutrient-dense foods replace processed ones, inflammation markers can fall sharply. Cholesterol may not change much at all, yet cardiovascular risk drops because the arteries are no longer under constant attack. This is the piece most people never hear. At this point, almost everyone asks the same question. If inflammation is such a powerful driver of heart disease, why does the medical system still focus so heavily on cholesterol? The answer is complicated, but it comes down to history and inertia. For decades, heart disease was framed almost entirely as a cholesterol problem. Guidelines were built around that idea. Treatment targets were defined by LDL numbers. Entire systems evolved around measuring and lowering cholesterol. Science, however, doesn't stand still. Our understanding has expanded. We now know that cholesterol is not the initiator of arterial damage. It is a participant that becomes dangerous only in an inflamed environment. Unfortunately, changing long-standing medical habits takes time. Many practitioners were trained before this research became widely accepted, and large systems move slowly even when evidence evolves. This does not mean cholesterol is irrelevant, and it does not mean every medication is unnecessary. Reducing inflammation and stabilizing plaques can be life-saving, especially for people who already have heart disease or very high-risk profiles. The problem arises when cholesterol numbers are treated as the whole story instead of one piece of a much larger picture. Treating a lab value without addressing inflammation is like repainting a house while ignoring a fire inside the walls. A more complete approach looks at both sides of the equation. Cholesterol levels matter, but so does the condition of the arteries themselves. When inflammation remains high, risk remains high, even if cholesterol appears perfect. When inflammation is brought under control, the heart becomes far more resilient, even in the presence of higher cholesterol. This is why some people continue to feel uneasy despite good lab results. They sense that something deeper hasn't been addressed. And often, they're right. Measuring and managing inflammation fills that gap. It explains why risk sometimes lingers despite doing everything by the book. And it points towards strategies that actually protect the heart long term. In the next section, we'll break down the most common hidden causes of arterial inflammation in seniors, the tests that reveal it early, and the specific daily habits that quietly cool inflammation and stabilize the heart. This is where real prevention begins, not with fear, but with understanding. 3 months later, Thomas's inflammation marker had dropped to 1.8. Now he wasn't just lowering cholesterol, he was controlling inflammation as well. That single change dramatically reduced his risk of another heart attack. And this is the critical lesson. It's not cholesterol versus inflammation. For people at higher risk, both often need attention. But if you're only treating cholesterol while inflammation remains high, you're missing the larger and more dangerous threat. At the same time, when inflammation is low, cholesterol may not need to be treated as aggressively as many people assume. Heart risk is not a one-size-fits-all equation based on a single LDL number. It's nuanced, it's personal, and it depends on what's actually happening inside your arteries, not just what appears on a routine lab report. That brings us to the most important practical question of all. How do you know if your arteries are inflamed? Helen's story gives a clear answer. At 69, she was worried about heart disease because her mother had died of a heart attack in her mid-70s. When Helen's cholesterol was checked, the numbers were moderately elevated. She was immediately advised to start medication. But before making that decision, she wanted a deeper evaluation. Additional testing completely changed the picture. Her inflammation level was low. A scan showed no calcium buildup in her arteries. Advanced testing revealed mostly large, buoyant cholesterol particles, rather than the small, dense type associated with plaque formation. Her protective cholesterol was high, her triglycerides were low, and her overall ratios were excellent. Despite the cholesterol number, every meaningful marker showed low risk. Helen focused on maintaining her healthy lifestyle rather than starting medication. 5 years later, she remains active, symptom-free, and free of heart disease. Her cholesterol didn't change much, but her arteries stayed calm because inflammation never took hold. This is what modern cardiovascular risk assessment looks like. It goes far beyond a basic cholesterol test. A complete picture includes 4 key elements. The first is the standard lipid panel, which provides total cholesterol, LDL, HDL, and triglycerides. This is only a starting point. The second is a high-sensitivity inflammation marker, which reveals whether blood vessels are under chronic inflammatory stress. Lower numbers suggest stability. Higher numbers signal danger, even when cholesterol appears normal. The third is a coronary calcium scan, which looks directly for plaque buildup inside the arteries. A score of 0 is powerful reassurance. Higher scores reflect increasing risk. The fourth is advanced cholesterol testing, which examines particle size and number. Smaller, denser particles are far more damaging than larger ones, even at the same cholesterol level. Together, these tests answer the question that actually matters. Is cholesterol causing harm in your body, or is it simply present without danger? So here's what to do next. Start by asking for comprehensive testing, not just a routine cholesterol check. Inflammation must be measured, not assumed. Ask about artery imaging and advanced cholesterol testing if available. You deserve the full picture, not a single number taken out of context. Next, learn how to interpret the results as a whole. Moderately elevated cholesterol combined with low inflammation, 0 calcium, and healthy particle patterns usually signals lower risk. On the other hand, normal cholesterol paired with high inflammation is a red flag that needs immediate attention. From there, focus first on reducing inflammation. Excess belly fat is one of the most powerful drivers of chronic inflammation, so addressing weight is critical if it's present. Refined carbohydrates and sugar spike blood sugar and inflame arteries, making their removal one of the fastest ways to improve risk. Omega-3 fats from fish actively calm inflammation. Vegetables provide protective compounds that soothe vessel walls. Movement matters just as much. Daily walking lowers inflammation directly. Strength training improves insulin sensitivity and reduces inflammatory fat tissue. Even moderate, consistent exercise can lower inflammation markers within weeks. Don't overlook hidden sources of inflammation. Untreated sleep apnea keeps the body in a constant stress state. Chronic gum disease silently fuels inflammation throughout the bloodstream. These issues can keep inflammation high even when diet and exercise are improved. Targeted supplements may help when used consistently. Omega-3 fish oil and curcumin have both been shown to reduce inflammation markers over time. These are not replacements for lifestyle changes, but they can support the process. Medications also have a role when used intelligently. For people with prior heart events or very high risk, certain drugs can be life-saving because they reduce inflammation and stabilize plaques. But taking medication based solely on cholesterol numbers without knowing inflammation status is outdated thinking. And if medication is used, inflammation should be monitored to ensure it's actually being reduced. Regular follow-up matters. Inflammation should be rechecked periodically. Imaging should be repeated when appropriate. Progress should be tracked, not assumed. Effective prevention is verified, not guessed. Here's the bottom line. Cholesterol has been blamed for decades, but it's not the primary villain. Inflammation is what turns cholesterol into a weapon. Inflammation destabilizes plaques, causes ruptures, and triggers clots. When inflammation is reduced, heart attack risk drops dramatically, often regardless of cholesterol levels. Some people learn this too late after a preventable event. Others learn it early and stay healthy for decades. The difference is not cholesterol alone. The difference is whether inflammation was recognized and addressed. Don't accept reassurance without understanding your inflammation status. Don't accept lifelong treatment decisions based on a single number. Demand a complete evaluation. Demand modern cardiovascular thinking. If this changed how you think about cholesterol and heart disease, share it with someone who needs to hear it. Subscribe for more clear, practical guidance that empowers you to protect your health with knowledge, not fear. Take care of yourself, and I'll see you in the next video.